The topic which we are going to discuss in this class is chelating agents. What are these chelating agents, or when does these chelating agents are used? Let us see, before entering into the topic, actually why these chelating agents are used. So these chelating agents are mainly used in heavy metal poisoning. What are these heavy metals? Heavy metals are the compounds or metal ions which have high density or high molecular weight, like compounds like arsenic, cadmium, copper, lead, mercury, etc. So these are the examples of few of the heavy metals. So these heavy metals, if they are given in very small doses also, they cause poisoning in the body. Or else if they are administered by mistake into the body, even in small amounts also, it causes poisoning and it causes very severe effects to the body. So these chelating agents are the compounds which are used in the heavy metal poisoning. And these heavy metals have some certain characteristic features, like they can bind to various metal ionic compounds like sulfonyl hydroxyl groups, amino acid groups, as well as imidazole rings, carboxyl rings. So these heavy metals, they bind to carboxyl, sulfonyl hydroxyl, amino acid, as well as imidazole rings, and they form some complex structures where they lead to heavy metal poisoning. Chelating agent. What is a chelating agent? So these are the drugs which are used in the treatment of heavy metal poisoning, or they are used as an antidote or antagonist for this heavy metal poisoning. So what is chelation actually? That is telling like chelating agent. So they have to have some particular process where the chelation occurs. So chelation is a process where the compound forms a new molecule, or else the compound forms a newer compound by combining with the other compound. Like the process by which these organic compounds combine with metal ions, they form relatively stable non-ionized ring complexes. In the sense, these metal ions, they combine with these organic compounds and they form a non-stable, which are not stable, and they are very complex ring structures. And these ring structures are easily breakable and they can form newer compounds also. So chelation is such a process. So these chelating agents, they combine with these heavy metal compounds and they form a different compound, thereby showing us antagonist effect of this heavy metal poisoning. And these chelating agents are also called as chelators, chelating agents, or sequestering agents. So these are flexible organic molecules. So these organic molecules, I told you, they combine with other metal ions and form new compounds. So these are forming new compounds with the help of a compound called as ligand. Ligand is a substance which forms complex structures when bind to the other metal ions by coordinate covalent bond, or else coordinate bonding. So coordinate bond is a type of bond where two molecules or two atoms or two ions combine to form a very strong complex or a stable complex. So these chelating agents, they form complexes with these heavy metals, or else they form complexes by replacing these heavy metals and thereby showing chelating process. And the name itself indicates what does the chelation. Chelation, or else the word chel in the word chelation means crab's claw. This is, these compounds bind to that metal ions like crab's claw. Crab's claw is very strong. Once it binds, it's not that easy to release from that crab's claw. So these chelating agents are such a compounds. So once they bind, they form complex rings, but once they release, they are easily dissociable. What are the mechanism of action of these chelating agents? So all chelating agents have a common mechanism of action. See, we can see the flowchart representation. Heavy metals combines with one or two more reactive groups. So these heavy metals, they select few of the metal ions in the body, or else they select some reactive groups called ligands, and they mainly bind to oxygen, sulfur and nitrogen containing ligands like OH, hydroxyl group, COO, carboxyl group, phosphate group, amine, as well as amino group, as well as SH, sulfoxyl group. So these heavy metals combine with these reactive compounds and thereby they form complex ring structures where they are causing disturbances in the cell structure or cell function. They cause enzyme inhibition. They produce oxidative stress in the body. So with these heavy metals shows these kind of effects. So these chelating agents, they form complexes with these heavy metals and thereby they form some newer molecules and which are non-toxic, or else they prevent the toxicity of this heavy metal poisoning and which are easily secretable, or else which are easily excreted out of the body. So what are the factors affecting this chelation? So what are the factors which are influencing for the process of chelation? So the relative affinity of chelator to heavy metal. So in order for a chelation process to occur, the chelating agent should have affinity for that heavy metal. So if it is not affinity, or else if it is not showing affinity to that particular heavy metal ion, then it does not form complex with that heavy metal ion. Then it can't show a chelating effect. The other one is distribution of the chelator in the body. So this chelating agent should be easily distributed in the body. If it is not distributed, then it can't reach the site of action of this heavy metal poisoning. The other one is capacity to mobilize the complex. So once it is forming a complex in a particular site, it should be easily movable. If it's not movable, then it can't be excreted out of the body. Then it causes adverse effects rather than showing chelating effect. The other one is half-life of heavy metal. So half-life of heavy metal also depends on the chelating affinity. So this half-life of heavy metal should be small. If the half-life is short, then it is easily excreted out of the body and it shows relative affinity to that chelating agent. If half-life is more, then it is very difficult for that heavy metal to be excreted out of the body. The other one is time after exposure. So the chelating agent should show immediate effect, or else it should be short acting. If it is not short acting, then the heavy metal shows its effects and thereby it will be very difficult for the chelating agent to antagonize this heavy metal poisoning. So what are the ideal characteristics of a chelating agent, or else what are the characteristic features for a compound to be called as a chelating agent? So these are few of the ideal characteristics. It should be highly water soluble. So it should move from one part of the body to the other part of the body. So it should be highly water soluble and it should resist to biotransformation reactions. So biotransformations are the metabolic reactions occurring in the body. So this chelating agent undergo biotransformation reaction, then it becomes inactive compound and thereby it cannot show chelating effect. So it should resist biotransformation reaction and it should have the ability to reach the site of heavy metal poisoning. So when it is easily movable, it can reach to any site where the heavy metal poisoning is taking place. So this is also ideal characteristic feature for a chelating agent. Another one is it should form non-toxic complexes with heavy metal. Once it is combining with heavy metal, the compound or complex which is formed should be non-toxic. If it is toxic to the body, then it is showing adverse or else a reverse effect instead of showing chelating effect. And the other one is it has to retain activity of pH in the body. So it should resist pH. If it is degraded in a particular pH, then it becomes inactive, which is of no use. The other one is a ready excretion of chelate. So it should be easily excreted out of the body. If chelating agent is remaining in the body for a longer period of time, it also shows side effects or adverse effects. It should have greater affinity for heavy metals than endogenous ligand. So there are various ligands present in the body. So this chelating agent should have more affinity than this ligand. If ligand is having greater affinity than chelating agent, then this ligand goes and binds with the heavy metal instead of this chelating agent. What are the chelating agents used? There are various chelating agents used like DIMERCAPROL, which is also called as BAL. The other one is dimercaptosuccinic acid, DMSA, dimercaptopropane sulfonic acid, DMPS, disodium EDTA, calcium EDTA, penicillamine and desferroxamine and desferriprone. These are few of the drugs which are used as chelating agents. So now, but today's class we are discussing mainly three major chelating agents, that is BAL, EDTA as well as DESFERRIOXAMINE, because these are the major or as first line chelating agents which are recommended in heavy metal poisoning. Let us see the classification of these chelating agents. We saw few of the drugs, but these chelating agents are classified based on which heavy metal poisoning they are used. There are various heavy metals, so each and every drug can't be used for all heavy metal poisoning. For example, see the drug called EDTA. EDTA is given when lead poisoning is occurred, or else it is used against lead. If lead is present in higher amounts or lead poisoning is occurred in the body, then EDTA is preferred. DIMERCAPROL is preferred in arsenic, copper and mercury poisoning. Succinimab is preferred in lead, arsenic and mercury poisoning. Penicillamine is preferred in copper, mercury as well as lead poisoning. And triantine is preferred only in copper poisoning, whereas desferrioxamine and defiprone is preferred in iron poisoning. These are the two chelating agents which are recommended to give against iron poisoning. Let us see in detail about DIMERCAPROL. DIMERCAPROL, which is also called as BAL, is a compound or as a chelating agent which is synthesized during Second World War by the Britishers. These Britishers, they have synthesized this DIMERCAPROL to antagonize the effect of arsenic poisoning. The opponents may release arsenic gas which is called as levisite. This levisite is an arsenic poisoning gas if it is released. So in order to prevent themselves from that arsenic poisoning, these Britishers have synthesized the compound called as DIMERCAPROL. This DIMERCAPROL is oily in nature and it is having some pungent smell. Pungent, and this is strong bad odor. So this DIMERCAPROL has such type of smell and it is a viscous fluid. If we see the structure, it is a compound which is having hydroxyl as well as sulfhydryl groups. There are two sulfhydryl groups. These are the major groups in order to bind for that heavy metal. So this SH group which is present in DIMERCAPROL, this is the major ligand which is binding to the heavy metal in order to antagonize the heavy metal poisoning. This DIMERCAPROL is administered in IM route. It is recommended to give this in intramuscular route in oil. So this DIMERCAPROL is mixed in the oil, arachis oil, and it is given IM route. And as I told you, SH group, SH ligands in DIMERCAPROL play a major role. They bind to the heavy metal and they replace the main ingredient of the heavy metal or main metal in the heavy metal, and thereby this SH group is binding to the heavy metal in order to antagonize the heavy metal poisoning. For example, we can see this slide. DIMERCAPROL is used in arsenic, copper and mercury poisoning. So here the SH group, it replaces arsenic metal ion in that heavy metals, and thereby it shows or else it antagonizes heavy metal poisoning. And DIMERCAPROL forms a metal complex which is stable and it is easily excreted also. Pharmacological actions. What are the pharmacological actions of this DIMERCAPROL? DIMERCAPROL, when it is combining with these heavy metals like arsenic, copper, mercury and other metal ions, it protects coenzyme A. Coenzyme A is a very important enzyme which is mainly useful in the various metabolic reactions. So this heavy metal, when heavy metal poisoning is caused, there occurs this fluctuations in the metabolism of the body. So when metabolism is not functioning, or if metabolism is not occurring properly, then it causes liver dysfunctions. So in that condition, this DIMERCAPROL binds to these heavy metals and protects the coenzyme A, and thereby preventing the fluctuations in the metabolism. And this DIMERCAPROL and heavy metal, when it is usually binded in the ratio of 1:1 or 2:1. So when 1:2:1 ratio shows more effect than 1:1. So 2 represents the BAL or dimercaprol, and this dimercaprol and BAL, when it forms metal and BAL complex, it is easily dissociable and it is easily excreted out of the body, and it is non-toxic to the body. And this elimination of this dimercaprol is occurred if the urine is only in alkaline state. If the urine is in acidic state, because of the protons which are present in the acidic urine, it can't be excreted in the urine, because it takes the proteins, or it takes the protons from the urine and it forms another newer complex. So it is very difficult if for the elimination of BAL in the urine if the urine is in acidic condition. So the alkalinization of the urine is necessary in order for the dimercaprol to be excreted out of the body. What are the uses of this dimercaprol? So the dimercaprol is mainly used in arsenic and mercury poisoning. Along with that, it is given as an adjuvant to calcium disodium EDTA in lead poisoning. So EDTA is mainly recommended in lead poisoning. So this dimercaprol is used as an adjuvant. If it is given with calcium EDTA, then it shows synergistic effect in lead poisoning. It is also used as an adjuvant to penicillamine in copper poisoning, and it is contraindicated in iron as well as cadmium poisoning. So we can indirectly say that this dimercaprol is used in arsenic, mercury, lead as well as copper poisoning, but it is contraindicated in iron as well as cadmium poisoning, because it forms, when it is combined with iron, the ferric form is converted to ferrous form, where this ferrous form is very dangerous to the body. What are the adverse effects of these dimercaprol? So the adverse effects is that when frequent dosing is given, then it forms adverse effects. So these are dose dependent. If it is given in particular dose only, it is efficient, or else it shows efficacy. If it is given in higher doses, it shows reverse effects. And it is usually given in the dose of 5 mg per kg, and it is general dose is 5 mg per kg, but for every 2 days we have to give 2 to 3 mg per kg at the dose of at the interval of 4 hours. And this is contraindicated in hepatic damage as well as cadmium and ferric poisoning. If the person is suffering from liver cirrhosis or liver related disorders, then this dimercaprol is strictly prohibited or strictly contraindicated. And there are various other side effects, adverse effects with this dimercaprol, like there will be rising BP, there will be tachycardia, there will be cramps, there will be sweating, headache, anxiety, inflammation of mucus, various mucous membranes, tingling and burning sensation. So these are the pharmacological side effects of this dimercaprol. The other compound is disodium EDTA. So the EDTA is a complex structure. When it is combining with sodium, it forms disodium EDTA. When the sodium is replaced with calcium, it forms calcium EDTA, or as calcium disodium EDTA is also present. So it is a disodium salt of EDTA. So when sodium is 2 molecules or 2 atoms or 2 molecules of sodium combined with EDTA, it forms disodium salt of EDTA, and it is a potent chelator of calcium, because this sodium can be easily replaced by calcium, and it causes tetany. Tetany is a condition where muscle cramps are occurred. So when IV injection of this disodium EDTA is given, then it causes tetany, and it can be used in emergency condition of hypercalcinemia. Hypercalcinemia is a condition where calcium overload is taking place. When calcium is overloaded in the cell, or when there is excessive amount of calcium present in the cell, then it leads to shock, hypovolemic shock for that particular patient. This condition, hypercalcemia condition, is very rare as an adverse effect of this disodium EDTA. But the dose of disodium EDTA is given about 50 mg per kg IV over 2 to 4 hours. For every 2 to 4 hours, this disodium EDTA is given. The other one is calcium disodium EDTA. So calcium EDTA is also present, as well as calcium disodium EDTA is present. So when calcium as well as sodium are combining with EDTA, they form this calcium disodium EDTA complex. So calcium EDTA alone is not recommended more because this calcium can be easily replaced by sodium, forming sodium EDTA, disodium EDTA. So this calcium is a chelator of sodium EDTA, and it has high affinity for lead. EDTA is used in lead poisoning. So this calcium, the chelator ideal characteristic feature is that it should have greater affinity for that heavy metal. So this calcium disodium EDTA has greater affinity when compared to all other chelating agents, and this is given, the dose route of administration is IV. Mostly IV route of administration is preferred than IM, because when given in IM it causes some sort of pain or a painful condition. In few people it may lead to severe pain also. So IV is more preferred than IM, and it is most important factor, or else it is mostly used in lead poisoning, and it is not used in cadmium as well as ferrous poisoning. Again, it is the only compound which is used in only lead poisoning, and it is poorly absorbed from GIT when given in IM or IV route. If we are giving it orally, then it enters into the GIT, it undergoes metabolism, and thereby it is easily absorbed in the GIT. But the EDTA is not recommended, or else it is not administered orally. So it is administered only in the routes of IM and IV. But if we are giving in IM and IV, there is a small disadvantage of this calcium disodium EDTA. It can't be absorbed in the GIT tract. And the other one is that it can't be metabolized. So if for every drug it has to undergo metabolism in the liver, but this calcium EDTA, it cannot undergo metabolism, and it is excreted through glomerular filtration. So in the kidneys, the nephrons can easily filter this calcium disodium EDTA, and it is excreted through glomerular filtration out of the body. What is the mechanism of action? The mechanism of action of this calcium disodium EDTA or disodium EDTA, they have the common mechanism of action. They replaces the heavy metal ions with this calcium or sodium, and thereby they form complexes with the heavy metals, leading to the chelating effect. And there is no, IV is not absorbed in the gut. We saw that in the previous slide. It can't be absorbed in the GIT. And one more thing is that no cerebral CSF penetration. It can't penetrate into the cerebrospinal fluid. This is the best advantage of this calcium disodium EDTA. What are the uses? It is mostly used in lead poisoning, and it is used in for iron, zinc, copper as well as manganese poisoning, but it is not recommended to give in cadmium poisoning or mercury poisoning. What are the adverse drug reactions of this EDTA? It has mainly adverse drug reactions with the kidney. It can cause kidney damage if given in overdoses. It may cause chills, fever, sweating, tiredness also if it is given in overdose. And if the dose exceeds their threshold limit, it causes anaphylactoid reactions. Anaphylactoid reactions are the allergic reactions. These are like severe allergic reactions which causes swelling of the face, and it releases large amount of allergens in the body. So these are very dangerous allergic reactions. In some cases it may lead to death also. The other compound is DESFERRIOXAMINE. So DESFERRIOXAMINE is a chelating agent which is used in iron poisoning, and it is given in the dose of 1 mg per kg, but it has low affinity to calcium. So this iron, it cannot replace with the calcium. So it has very low affinity to the calcium, and if it is administered in little dose orally only, it is absorbed in the body. Even in small amounts of, even it is given in small amounts orally also, it is easily absorbed in the body. And parenteral route is, if it is given in parenteral route, instead of showing higher bioavailability, it undergoes metabolism and it is rapidly excreted in the urine. So when it is rapid excretion occurs in the urine, then the bioavailability of this DESFERRIOXAMINE in the blood decreases. When it is not available in the blood, then it can't show chelating effect. So that is the reason oral route of administration is more preferred in this for this particular drug instead of IV route. What is the mechanism of action of this particular DESFERRIOXAMINE. So DESFERRIOXAMINE, it binds with the ferric ion, Fe2 plus ion, and whereby it forms stable non-toxic compound. So this DESFERRIOXAMINE, it binds to the Fe2 plus compound, and thereby it forms some stable and with the compound and which is non-toxic to the body. That is the reason. And from after forming this compound, when after entering into the intestine, this metal is easily dissociable. Even though it is stable, it is easily dissociable, and this is excreted out of the body. It also removes iron from hemoceritin as well as ferritin. So the hemoceritin and ferritin are the compounds which are if administered into the body. So this DESFERRIOXAMINE, it removes the iron from these compounds, but it does not remove iron from hemoglobin. So hemoglobin also contains iron in the iron as a major compound. If we see hemoglobin structure, it contains Fe2 plus compound in its structure. This DESFERRIOXAMINE, it does not remove iron from the hemoglobin, but if at all any other compounds which are containing iron and which are causing poisoning to the body, then this DESFERRIOXAMINE removes such kind of ferrous or ferric forms of iron, and thereby it is showing or else it is antagonizing this iron poisoning, and it has low affinity for calcium. What are the uses of this DESFERRIOXAMINE? This DESFERRIOXAMINE is mostly recommended in through subcutaneous route as well as intravenous route at the dose of 0.5 gram vial. So 0.5 gram vial of this DESFERRIOXAMINE is available, and it is given through subcutaneous or IV route. And it is used in acute iron poisoning. When compared to chronic poisoning, acute poisoning, in the acute poisoning condition, DESFERRIOXAMINE is mostly preferred, and it is used in transfusion acidosis. In this condition, in this particular transfusion acidosis condition, when there is occurring any transfusion of body fluids, then if blood, for example, blood transfusion is taking place, if the compatibility of the blood is not same with that particular person, or if there is any problem with the blood transfusion, then there occurs iron poisoning, because hemoglobin contains iron, right? So in that particular condition, in order to prevent iron poisoning, this DESFERRIOXAMINE is recommended in the dose of 0.5 to 1 gram per day, 1 gram per day through subcutaneous route, or it is given through blood transfusion in the dose of 2 grams per unit of blood. What are the adverse effects of these DESFERRIOXAMINE? If DESFERRIOXAMINE is given in overdose, it causes hypotensive shock. So what does it do? It reduces or else it decreases the BP to its minimal level. The minimum blood pressure is 120 by 80. So the blood pressure is reduced below this, and thereby it leads to shock. This is called as hypotensive shock. It causes abdominal pain or abdominal cramps. It causes muscle cramps, and sometimes it causes fever. What are the role of these chelating agents in dentistry? So these chelating agents are the compounds, mainly our teeth contain calcium, right? So these chelating agents form complexes with the calcium and thereby depleting the calcium which is present in the tooth. So these chelating agents should be given when the teeth, or else there is a particular procedure like the teeth should be covered with some protective layer, and thereby these chelating agents are administered if at all to be given. So these, if they are given through orally, or else if they are given in any particular part of oral cavity, then teeth should be protected. These are because they causes irritation to the root canal. The root canal which is present or else which is holding the teeth, it causes irritation to that particular root canal. So that is the reason chelating agents, if administered in oral cavity, should be taken or else administered with proper care.